Is treatment still needed after a hair transplant?
For many years, during consultations for hair loss treatment, I found that a lot of my patients with male pattern hair loss were under the impression that the most definitive solution for their hair loss was a surgical hair transplant. Hair transplantation, regardless of the method used, is the transplantation of genetically resistant hairs from the back of the scalp to the front of the scalp. While hair transplant surgery does put hair in areas with little or no hair, it does not change the continuous progression of hair loss afterwards. I'll discuss why having a hair loss treatment strategy is very important, especially after a hair transplant. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. Throughout much of my career, hair transplant surgery was a significant part of my practice. In an effort to improve the outcomes, about 10 years ago, I started using a wound healing material called acellular matrix to improve the healing process in the donor area and to improve the survival rate of the hair grafts. We observed that a year later, thinning hair that wasn't transplanted became thicker. This discovery inspired me to come up with a system to treat hair loss. The challenge was to come up with a predictable treatment protocol for customization in order to meet the unique needs for each type of patient. I developed a system where I factored in key variables such as age, gender, age of onset of hair loss, and severity of hair loss to customize treatments that will work best for your profile. This treatment can be used for men and women who've previously had a hair transplant. Our treatment for hair loss, which I trademarked TrichoStem Hair Regeneration, has also been very successful as an alternative to hair transplant surgery. As a pioneer of this new treatment for over the past 10 years, I've helped a wide range of people who came from around the world. With scalp coverage improving in over 99% of patients, it's clear why TrichoStem Hair Regeneration stands as the benchmark to compare any other ACell plus PRP treatment for hair loss that interestingly appeared so many years after we started. Hair transplants are marketed and perceived by consumers as a solution for genetic pattern hair loss. The reality is that hair transplant alone does not treat progression of genetic pattern hair loss at all. The characteristic progressive hair thinning will continue after surgery. For example, when you see a person who had an obvious hair transplant where you see the so-called plugs of hair that are growing in isolation, they're often labeled as having had a bad transplant. In reality, they didn't start out that way. They actually probably looked pretty good for a few years after their transplant surgery. However, with time, only the grafted hairs that are genetically resistant to hair thinning remained, while hair thinning continued and the native thinning hairs eventually disappeared. This is one of the main reasons why I discourage men in their 20s to undergo hair transplant. Even with multiple transplant surgeries, rapid hair thinning will leave the coverage sparse and looking unnatural. Not only will they not look like the same as the contemporaries who don't have hair loss, but as they get older and reach their mid-30s, the residual grafted hair will have poor density, look artificial. In my experience, a lot of people who choose to undergo a hair transplant as a solution for their cosmetic concerns are frustrated by the limited results of their surgery. Invariably, they end up having a second transplant, where they are further frustrated, so they find another surgeon to do their third transplant. In the end, regardless of the number of surgeries they had, they find themselves in a situation where they've spent a lot of money, undergone a lot of pain and recovery, and no longer have any more hair left to harvest for further transplantation. This is not a good position to be in. Unlike other cosmetic surgical procedures like eyelid surgery, facelift surgery, or breast implant surgery, there is much greater variance in the outcomes of hair transplant surgery. In the marketplace, the advertising does not reflect the actual reality of hair transplant outcomes. In my opinion, the problems arise due to patient selection, the setting of unrealistic expectations, and basic issues regarding blood supply, bleeding, and scar tissue. Oftentimes, the patient who has undergone 2 transplants had the second transplant done by the same surgeon who did their first transplant. However, there was no difference in how the surgeon approached the second procedure. Consequently, the yield from the second transplant is not only less than anticipated, but there is often further hair loss due to the trauma to native existing hairs and poor graft survival. When it comes to patients who have had hair transplant surgery before coming to see us, they essentially fall into 3 basic situations. 1. An individual who had hair transplant several years prior and is looking to avoid having to do a second hair transplant while they're experiencing hair loss progression. 2. An individual who has in the past 3 months had a hair transplant and wants to optimize their healing and growth of their existing native hair. 3. An individual who has had 2 or more hair transplants over several years and is noticing the quality of their transplanted hair is diminishing in addition to worsening of their scalp coverage due to natural progression. In order to understand how we manage these patients, we should first briefly cover how TrichoStem Hair Regeneration treatment is used for people who have never had a hair transplant and are experiencing androgenetic alopecia, or genetic pattern hair loss. The TrichoStem Hair Regeneration treatment has over a 99% success rate for men and women experiencing genetic pattern hair loss. The success is defined as visual improvement in hair thickness and scalp coverage. With TrichoStem Hair Regeneration, we are essentially reactivating hair that is not growing because of a prolonged resting phase. We're thickening hair that was thinning and increasing the longevity of the hair growth cycle. One of the advantages of TrichoStem Hair Regeneration over hair transplant surgery is that native hair grows much closer together than what can be achieved even with multiple hair transplant surgeries. Further, by thinning native hair and stimulating hair growth, TrichoStem Hair Regeneration treatment can achieve better scalp coverage than not just 1, but 2 hair transplant surgeries for many of our patients. Typically, we treat each patient with a 2-year plan where we do 2 separate treatments approximately 18 to 24 months apart, and we expect sustainable benefits in the range of 3 to 5 years or even more. Additional medical management, including DHT blockers, nutritional and medical therapy, may be indicated depending on the category you're in. We see our patients every 3 to 6 months and review results with them to show how they are progressing over time. For patients who have had hair transplant surgery, it appears that our TrichoStem Hair Regeneration system provides an optimal environment to help both their hair grafts and their native hairs. I had the unique perspective of performing hair transplant surgery for many years and developing a significant non-surgical treatment for genetic pattern hair loss. With all of this clinical experience, in my opinion, you can optimize your appearance with non-surgical options and delay, if not avoid, further hair transplantation in the near future. Regardless of the type of hair transplant you've had or plan to have, your genetic pattern hair loss will continue to progress. Although hair transplant surgery has a potential role for improving appearance, particularly for men with frontal hair loss, it's important to recognize that a strategy for the long term is critical to avoid regret and frustration. I hope you found this information helpful. Thank you for your question.